How are we doing, YouTube? Nick Pratap here from Next Gen Rehabilitation, and in today's video we're going to be going over a question from one of the viewers actually on some of my experiences with the interview process with becoming a clinical exercise physiologist, as well as where I'm currently working, how the interview process went, how it is to find a job, and evidently what I'm doing right now. So to get started with the whole job experience and going ahead with the interview process, it was a little bit of a challenge. When I first got certified as a ACSM clinical exercise physiologist, being able to find work was tough. At least where I live, I'm in Canada, so there weren't too many opportunities around where I'm necessarily living right now. So over the course of a few weeks, even maybe into a couple months, would consistently go online, go on Indeed, job sites to look for exercise physiologist positions. And luckily for me, one came up for a casual at one of my local hospitals. So I went in and I did an interview. It was a panel interview, so meaning it was myself along with 3 interviewees. One was the manager, one was a clinical nurse, and one was a clinical exercise physiologist. And how it worked was they kind of rotate through each other, and they asked me questions. Each of them write down the response I had, and based on my response, I get graded out of a score, whether it's out of 3, whether it's out of 5, based on the significance of the question. If it's more related to actual clinical practice, it's going to be worth a 5. If it's more related to basic life skills, how does this person interact with other people, how do they work in a team, that might be scored medium to the higher end. So after that interview, luckily I was able to get the job, and I started as a casual. And working as a casual was a little bit of a challenge as well. I mean, you have to be ready for shifts. It's kind of hard to plan things with friends, with family. So that was hard, but knowing that building up your hours is the name of the game, and if you wanted to go far in this field, it's a necessary step that you need to incorporate into your life. So I worked as a casual for roughly a year and a half, 2 years, and then another opportunity opened up. Actually, there's a couple health authorities that we have here where I live in Canada. And so when that opportunity opened up, I again applied for a casual. This was a panel interview again, but only 2 people, similar style, similar questions. Some of the questions again that they go over in the interview are more based on clinical exercise. So situations, if someone's having chest pain during exercise class, what do you do? If someone complains that they were experiencing dizziness, lightheadedness during the weekend and they come into exercise class, what do you do? If you see specific blood pressure numbers, specific blood sugar levels before exercise actually happens, are you going to allow that person to exercise that day if it was too high or too low? If the blood sugar is too low before exercise, what do you need to do? So clinical questions like that, and then as well as your typical interview questions. What are traits that you find separate you from other individuals that are applying for this job? How do you work in a team setting? What would be some things that people would say about you to describe you as an individual? So you definitely had your typical interview questions, but then you also had a lot of clinical exercise physiologist questions. So knowing your information, certain values on what's a correct cholesterol level for someone that has heart disease, what are parameters we're looking for blood sugar for someone that's pre and post exercise, things like correct CK, ALT, liver enzymes, things like that, right? So things you should have a pretty good understanding of, and then as well as your basic questions that you receive in any interview. So after I did that interview and I got the job with this other health authority, another opportunity came up where I was actually able to get some more hours, and that eventually led to me getting a part-time job with them. So that was great, and then eventually about a year later that ended up leading to some more hours. So it really comes down to you just being consistent and being open to all opportunities and opening as many doors as you can for yourself. That's why I really highly preach getting volunteer opportunities, doing practicums whenever you can, getting out and about, meeting people, meeting doctors, meeting nurses, meeting other exercise physiologists that can potentially be mentors for you, and just being involved in the space, right? The more you're in the area, the more you're able to interact with these people, the better it's going to be for you in the long run, because if opportunities do open up, you'll put yourself in a better position to be able to accept that opportunity and advance your career. Now, when it comes to actual positions and how many exercise physiologists I work with, so in my current job right now, I work with about 6 other exercise physiologists. Four of us have backgrounds in kinesiology, and 2 of my coworkers have backgrounds in nursing. So it's quite the mix. It's quite an interdisciplinary team, and how it works on my specific side is we all have our own classes that we're delegated to. So I currently run 2 classes in hospital, and I run 2 classes in the community that I'm responsible for. Some of my colleagues have 2-3 classes maybe in the hospital, so we're responsible for the medical supervision and the exercise prescription of these clients and patients. In other settings that I've worked at, there can be anywhere from 1 to 2 exercise physiologists working at a time, followed by having a nurse there. So again, in my specific setting, we have 2 nurses that are always on site. We have a cardiologist that's on site. We have a dietitian, social worker, and psychiatrist. Psychiatrist comes in once a week, and social worker comes in twice a week, but the dietitian is always present. So that's where the inter-referral comes in. Again, at other settings, we might have 1 nurse, 1 exercise specialist. You might have a fitness instructor that's actually leading the class, while the exercise physiologist is overlooking the patients, making sure they're doing okay, checking for symptoms, that sort of thing. So it does really vary. When it comes to actual positions, it really depends on the area that you live in, how many hospitals are in your specific region. So for me, we have about 6 sites where cardiac rehab is offered, and within each of those sites, other than the site I work at, there's roughly about 2 to 3, I'd say around 3 exercise physiologists, okay? And all of them aren't full-time either, so each site usually has about 1 full-time exercise physiologist and 2 part-time exercise physiologists. The part-time, you're looking at anywhere from maybe 20 to almost 30 hours a week, whereas full-time, you're getting the full 40 hours a week. And that's just how the class breaks down, in terms of needing an exercise physiologist there, the funding that they're able to actually pay you to be there. So that might be a little bit of a challenge, again, depending on the area you're in. But at the end of the day, it really comes down to you getting out there, trying to get the experience. If this is something that you do want to do, I feel like there's going to be more private clinics opening up, which will definitely open up more opportunities for new grads coming out of school. And even if you can't start as an exercise physiologist right away, you have opportunities to work as an exercise leader or fitness instructor within a cardiac rehab setting. So meaning you're the one that's going off the plan that the exercise physiologist made, and doing the group exercise stretching, the group warm-ups, the group cool-downs, helping patients get set up on machines, that sort of thing. When it comes to answering medical questions, obviously you don't want to go out of your scope as a trainer and leave that to the exercise physiologist. But you can definitely help answer some exercise related questions. What's a set, what's a rep, how do I use this machine, what is this specific bicep curl or chest press machine, how is that going to help my body, how is it going to help me with posture, that sort of thing, right? So anytime you can get your foot into any doors, network, that's what I always recommend as well. If you can get out to these meetings that offer positions for you to meet new people, that's always exciting, and that's always another opportunity that you can open up for yourself. So hopefully I was able to help out. Again, my name is Nick Pratap, and we'll see you in the next video.